We'll now move on, and it's my great honor to introduce two-time U.S. Ambassador and Council Senior Vice President, Regional Managing Director, Michael Michalak. Mike, the floor is yours.
Thanks very much, Alex. As we have seen, it's been very exciting to go through all of the speakers in the event that we've been having today. And as you've heard, the U.S. government is looking to increase the level of engagement. This increased level also means that we're prioritizing health cooperation in the Asia Pacific, particularly focusing on COVID-19 relief and vaccine diplomacy. You've heard from other speakers firsthand how the COVID pandemic underscores the importance of our healthcare infrastructure and how healthcare and the economy are inextricably linked, both in the United States and in ASEAN. So it's important to understand where this linkage is going, how to do it more comprehensively, and how to do it better the next time we run into a pandemic. So during the conversation today, I'm pleased to welcome two distinguished guests with decades of experience in the healthcare sector. Menassie Taddese, President of Emerging Markets for Viatris, and Dorthe Mikkelsen, MSD's President for the Asia Pacific. For our first question, I want to start with Dorthe. And Dorthe is the President of MSD in the Asia Pacific, based in Europe. And the Asia Pacific region for MSD has about 7,000 employees across 12 key markets, which represent pretty much all of Asia, ex-China. So Dorthe, given your perspective and from your role overseeing APAC, what is your perspective on healthcare spending and its impact on the economy in the region, particularly in ASEAN?
Thank you, Mr. Ambassador, and thanks for the opportunity to participate in today's event. So the ongoing COVID-19 pandemic has really underscored how vital health is to our shared economic prosperity. And as we've seen how the COVID-19 leads to national lockdowns, it has slowed down economic activities, and in some cases even put industrial production on hold. It has caused a significant decline in GDP in more than 3% here in Southeast Asia. So as future pandemics will likely or could be more frequent and deadly, we cannot wait to overcome only COVID-19. That's a priority, of course, but we also need to think about urgent global investments in the healthcare sector. This was well noted recently during a panel presentation at the G20 Finance Ministers and Central Bank Governors meeting, which was held earlier this month, actually. That panel had called for 75 billion in investments over the next 5 years to combat future pandemics, which may otherwise cost governments 700 times more than what had been proposed as additional investments. So clearly, investments in healthcare systems and preparedness is well needed. Aside from tackling the pandemic, research by McKinsey has also shown that at a broader level, reducing the global disease burden can in fact add $12 trillion to global GDP by 2040, with a return of 1 to 4 $4 in every dollar invested. So this again documents that investing in health and in improvement of health can play a very meaningful role in the long-term economy of the world. And health spending is therefore not only a cost, but an investment that impacts the economy positively. And one area it impacts, of course, is productivity. Indeed, as we look at workforce productivity gains, the example in Australia, where the economy loses over 500,000 full-time person years every year, and that reduces the Australia productivity by 10%, and obviously is a drag on its economic growth. So as we think about such immediate concerns in the economy, a longer-term horizon is also the research and development perspective. So just summarizing that, health spending is not a cost, it's an investment in health, and health is the key to the wealth of a country. Healthy people work longer, they work harder than sick people, of course, and countries that improve their citizens' health grow faster. So that's why we should focus on investing in health, not only for the current COVID-19 pandemic, but also for the longer term, and investing in health is an investment in the future of our region.
Great, thanks very much. And now I'd like to turn to Menassie Taddese, who is currently the president of emerging markets at Viatris, a new kind of healthcare company created by the merger of Mylan and Upjohn, a legacy division of Pfizer. In his role, he oversees 125 markets, over 200 brands, and leads a team of 3,500 people. Menassie, how do you see this relationship playing out in ASEAN and other similar markets in your purview?
Thank you very much for the question, Ambassador Michalak, and thank you for everyone participating in this fireside chat, especially my partner, Dorthe. More than a year into this pandemic, Ambassador, we've learned that health security is a matter of national and economic importance, and that none of us are safe until all of us are safe. Investments in healthcare is directly related to economic development of a country. As Dorthe pointed out, a healthy population is a productive and happy population. Well-considered and consistent healthcare investments build a resilient healthcare system that will enable us to be able to meet the challenges of the future and protect the most vulnerable amongst us, which were disproportionately affected by this pandemic. For me, both personally and professionally, increasing access to healthcare is a key priority. We must continue to invest to be able to innovate in order to strengthen our healthcare systems, because fostering a more resilient and inclusive healthcare system will be able to help our societies move forward together. At Viatris, we've worked hard to be able to reach communities on the ground to be able to provide access to vital healthcare. As the WHO points out, 85% of all non-communicable deaths, and I'll bring that linkage back a little bit later, are happening in emerging markets. In these emerging markets, 125 plus of them, we do some of our best work in providing and establishing effective and sustainable partnerships in order, again, to reach the most vulnerable communities with healthcare that suits them, that is tailor-made for their societal, environmental, and unique challenges, which are very different than developed markets. And just to give you an example here, very specific to ASEAN, last year we hosted a first of its kind Partnership for Change Summit in Singapore. This was to be able to stimulate changes in the management of non-communicable diseases, some of the underlying causes of COVID-related deaths across emerging markets, bringing health experts and other leaders representing both medical and professional societies, academic institutions, patient associations, and others across Southeast Asia, but also including Latin America, Africa, the Middle East, to be able to exchange experiences and insights on the best practices to be able to address this pandemic, but also the related NCD burden that these markets are facing.
Thanks very much for that answer. But obviously, over the past 18 months, we've seen a tremendous amount of government spending to combat COVID-19 around the world, coupled with a severe downturn in the global economy. But Menassie, let's take a little bit more a deeper dive into what you were just saying, and that is, where's the balance between combating COVID-19 or the next pandemic, and then also trying to address some of the other important healthcare challenges, like you just mentioned with rising NCDs?
Ambassador, there's no easy answer to this, but I'll take a stab at it. The recovery across Southeast Asia from a healthcare spending perspective will remain challenging as countries confront unexpectedly strong COVID outbreaks and multiple waves, as we all know. Most health ministries across the region have increased their budgets, but this increase is going to be insufficient to be able to cope with the cost of COVID-19 and the physical burdens that have been accumulated over time. Governments are seeking, cost-effective strategies to be able to manage public health expenditure while expanding broad primary care-based access and disease screenings to be able to reduce catastrophic health expenditures. To me, that's one of the keys here, is to being able to get ahead of it and to make sure that we've got health systems that are equipped to be able to avert some of the daunting statistics that we see. In ASEAN, giving you the emerging markets perspective according to the WHO, in ASEAN, the leading cause of death is non-communicable diseases, accounting for some 62% of all deaths. That's about 8.5 million people per annum. And as the WHO again points out, approximately 50% of these occur in people under the age of 70. So preventable diseases in a relatively young population. 4 major NCDs, for those not in the field, we're talking about common issues that you know of: cardiovascular disease, diabetes, cancers, respiratory diseases. Those are leading to 80% plus of these premature deaths, as the medical folks define it. And then the other piece that we can't shy away from at this point is mental disorders, the 5th leading contributor to these NCDs, and frequently comorbidities for the 4 major NCDs that we've just described. But overall in ASEAN, 44% of what is defined as total disability adjusted life years are lost, specifically around NCDs, and mental health being the largest one. So for me, Ambassador, the scale of this premature and preventable deaths, NCD, COVID is somewhat related, and again, I'll come back to that, will require serious public health concern and require a whole system approach, warranting a response not only from doctors and allied healthcare professionals, but also policymakers, educators, private sector, society, all of us, including the patient at the center, in order to be able to help move this forward.
Right. Well, Dorthe, I'd like to direct the same question to you, and rather than framing this as a trade-off during the next pandemic or other similar emergency, how do you see governments and private companies striking the balance, and what are your views on some of the other major healthcare issues that need to be considered within that balance?
Yeah, certainly. Let me follow up on my co-panelist Menassie's comments and say it's not easy. We are going to have to do both. We are going to have to overcome the current COVID-19 battle, where yesterday I think we've seen more than 6 million confirmed cases and thousands of deaths. So while we have, vaccine supply shortage, there are logistic hurdles in the rollout of vaccination. It does seem to be the way forward, and especially due to the challenge of new waves of infection and variants. And I would say we're fortunate because the biopharmaceutical industry, continues to invest in innovations, and that's why, there is hope that we can battle this pandemic. Besides the breakthrough in vaccines by a number of companies, as a result of decades of investments into research and development, there are also innovation and progress forthcoming in COVID-19 treatments. For instance, MSD has a program there now moving into phase 3. So, we hope, of course, all that there is going to be positive news, but data still to show. I do also agree that there is a need to return to care, to other diseases than COVID-19, and especially to the NCDs, the non-communicable diseases. Critical care has been delayed. Routine vaccinations have been either stopped or postponed. And health screening, for instance, for cancer and other chronic diseases, we know are obviously being put on pause. So there is data available, for instance, on vaccination, that there has to be now a revitalization of the back to care and some of our basic vaccination programs. The WHO has now shown that among 68 countries in the world, there is an estimated 80 million children under the age of 1 who has not been vaccinated or who is now currently under-vaccinated. So specifically, that means common diseases like measles, rubella, and polio outbreaks are threatening, and there is a number of campaigns there that has been postponed. And measles, for instance, that most of us know, is even more contagious than COVID-19. So that could be only a matter of time. So we do need to restart the routine vaccination programs that were in place even before COVID. And in oncology, as I said, there we actually don't have time. So people who are delaying potentially cancer diagnosis or cancer care don't have time and may die as a consequence of postponing the cancer care that they should get. So there is now also numbers documenting that. And as we look at the prevalence in our region, in the ASEAN region, the expectation is actually that the number of cancer cases are going to grow tremendously and much more than in the rest of the world in the years to come. So there's also a real challenge in investing and refocusing in parallel with COVID-19 on cancer care. So I do think that we're going to have to balance and going to have to do both. And hopefully we can do that in public-private partnership across the region.
Right. Well, that's an excellent segue. Can you, we are out of time, but I want to press it a little bit anyway. Can you give us, why don't you give us maybe one lesson that you can think of from the past experience that we've had with COVID-19, the pandemic, in terms of the balance and the investment that we need for healthcare to moving forward, to figure out how can the private sector partner with governments to ensure that we do it better the next time. So give me about a minute, and then I'm going to ask Menassie to do the same thing.
Thank you. I do believe and I'm very hopeful, I do believe we're seeing tremendous, efforts and outcomes of the COVID-19 pandemic and how private and public can work together. I do think moving forward, it's about ensuring sustainable funding. So we do need governments to invest in the area of health. I spoke to earlier about productivity and of course health of a population as the path forward to prosperity. And second, also that we work together to ensure sustainable access based on, of course, data, health technology assessment methodologies, so that we assess the value of medicines in a given country and in a given region. So that every country, utilizes the technology, the innovations that they have at hand, and do that in a collaboration with the industry, with academia, of course, with patients, which is a very important voice in healthcare system, and with other stakeholders who have an interest in health. Great.
Menassie, I'll give you the last word. What's your view on the same question?
I'm going to preface it with a few data points, Ambassador, but just so we can all walk away. 41 million people on a per annum basis globally die from NCDs. What we know is that 60 to 90% of the COVID deaths had some underlying NCD. As I mentioned a little earlier, 8.5 million of these people are dying annually in ASEAN. So we clearly know that. We clearly know that we have to do better. In the early stages of this pandemic, what we saw was hesitancy for patients to be able to receive care, out of stock supplies, diagnosis being delayed and in some cases canceled. Dorthe talked about it in critical areas like cancer, and for that matter, underlying chronic conditions. That's almost a death sentence in a lot of ways. And so how do we move towards a patient-centric universal healthcare model that a lot of our markets are moving towards? There's a lot that we can learn from this pandemic. I'll give a shout out to a particular publication, the Risk Management and Healthcare Policy Journal, that has published a study which has a 5-point plan specific to ASEAN. It's about policy gaps. It's about addressing clinical practice shortcomings and a number of other areas. But for me, the takeaway, Ambassador, is really getting patients at the center of their treatment, educating them, making sure that they're participating in their own healthcare. And as such, one patient at a time, we can get to the level of public health advances that we'd like to see. The link between economic and healthcare at a country level, at a region level, and at a global level is no doubt there. How do we move ahead to make sure for the next pandemic, for the next outbreak, we're much better prepared than we were at this time around? But thank you very much for this important conversation.
All right, well, there you go, Alex and Satu. That's kind of a serious note to end the end of this wonderful event, but it also shows that there's still hope out there through patient-centered care, through working in partnership with governments, as this wonderful publication that we're talking about today is one way in which we can begin or which we can continue to move this partnership forward and make the best advantage of the partnership that we've developed between ASEAN and the United States. So in fact, ASEAN matters for America, and America does matter for ASEAN.